Hello, everyone, and thank you for joining us for today's presentation hosted by Jibestream, the premier indoor mapping platform provider. Indoo.rs, your professional indoor positioning system provider, and special guest, Contact.io, a premier beacon manufacturer. Speaking today will be Jibestream CEO and co-founder, Chris, Indoo.rs CEO and co-founder, Bernd, and Contact.io CEO and co-founder, Shima.
Thank you, Jody. And today we're going to talk about the future of connected healthcare. Before we get started, or as we get started, I'd just like to sort of set some of the context of where we are today in the healthcare world and really the shifting dynamics around it. I don't think it's going to come to any surprise to anybody or new information that there's just more and more pressure to improve the patient experience and patient outcomes. But peeling the onion layer back a little bit further, that really now has become having to create a better experience for patients, which means lots of different things. Something that's more dynamic, definitely accessibility in all respects is important, but access to information is more important than ever, and really to create something that's engaging. And the pressure of this is probably coming from the experiences that we have outside of hospitals, at malls, and really the concept of the experience economy. And that really is putting the pressure that we have to create really great, memorable, and positive experience for people while they're at the hospital and on their way and to and from these sort of things. So definitely mounting pressure there from things that we do every day. And sort of the trend today, I would say, is what Gartner refers to as the real-time health system or real-time health system technologies. And as you can imagine, the meaning of the name is really all about real-time information. And that is in the goal of delivering information the fastest way possible, but with the most amount of context. And the other way that we can think about that is really just interoperability between systems and being able to share information between probably what were normally siloed data sets and otherwise that now are coming together. It really is a paradigm shift. This is, another way to refer to it is situationally aware and patient-centric. And this really isn't just about the patient experience, it's also about the operations and the management of the facility. As sort of a building block for this, wayfinding can really be that first gateway into, on-ramping to the real-time health system. It is the first foundational layer that really paves the way in terms of we have to digitize the space first to be able to access it, with the APIs and be able to manage moves and adds and changes. And then we can start to bring in different data sets from check-in, from appointment reminders to location-based messages. But we really look at wayfinding as the first point solution to what will be built upon with a platform to satisfy other use cases going forward. But we really would consider this to be step one, and it solves a lot of pain points very quickly. There's a ton of traction around wayfinding, and as Gartner refers to it, experiential wayfinding. Today, we're seeing it as an innovation trigger, and really only 1% of the hospitals today have this digital experiential wayfinding solution out there. But what's really interesting and exciting is that within 2 years, they're projecting that 25% of facilities will have this. That's just tremendous and enormous growth with a ton of velocity behind it. So it's definitely an exciting time to be part of this space. And it's also no longer a nice to have. I think that facilities in the past have looked at this as something that we're going to do if we have extra budget, if it's something as sort of a project-based initiative. And now it's becoming a critical component for example, most wired hospitals. It's a checkbox there to have experiential wayfinding, and it really is what creates that experiential positive experience that we're looking for. And it has changed. It's not just getting from A to B anymore and helping people navigate from a parking lot to their appointment. It's really, as again, Gartner, as they describe it, it's now being used to sense and collect and analyze all different kinds of real-time data that's going to not only guide the patients, but it's really taking them from the whole continuum of care from the time they get to the hospital, from the time they leave home to the hospital and back again, because we know that the experience does just not start at the doors of the hospital. So it's really taking all that into consideration and delivering context to them as they're going through their journey. So we talk to a lot of product managers, and the things that we typically hear from product owners and product managers is that it's not just enough to know where something is. they need the context of what's its status. If it's a person, place, or a thing, what's going on around it. You'll see later in the asset tracking demo, the infusion pump, is it not only available right now, but does it have a charged battery, and is it clean and ready to go? So context is very important. I just said that, in the next 2 years, we're going to go from 1% to 25%. Time is not on our side as a product owner. They need to do things quickly, but at the same time, thoughtfully considering security. And, this is ever more important in the healthcare environment. Who owns the data? Where is it being used? And also scalability. This is not something that people are looking at as just deploying into one hospital as a POC. Can it scale out to the whole enterprise? And also, more importantly, does it have more than just one use case? So wayfinding being the first one, there's going to be ones that follow once this is successful, and we need to be able to build upon that. And it has to be open to be able to integrate the things that we want to do today, but also as things change, we want to be able to adapt to that, and in short, really be future-proof to the technology. So also speaking to product owners and hearing some of the things that are on their mind is really all about what are the risks and challenges. Well, there are no standards. This is certainly not a fresh new market, but it is something that has been growing, and there's really just no set standard there. So that creates a challenge. This is largely dominated today by point solutions. And there's a business case there to say leverage the same investment to not only have the first use case, but many more after that. And if you've read any the PR releases and product releases, all these sort of things, every day we're seeing new things come out, and it's really a dizzying amount of different technologies, and it's always changing. Can't say enough about data ownership. There's a lot of concern around that and how we're protecting ourselves. And then to be able to manage the complexities of all the different use cases and integrations and things that are going to go on really are much easier to think about ahead of time rather than afterwards. So we have to architect something that is going to make sense, not just for now, but into the future. And where we stand today in terms of our business needs and our technology requirements, for sure is going to be different next year. So how do we protect ourselves against that? Well, we want to make sure we avoid closed systems in nature that really are could paint us into a corner, maybe forcing us to rebuild if we choose the wrong technology. So I want to just stop there for a second, and I've given this sort of why now, but maybe we'll look at why not now. And although lots of people are doing this, we're going to open a very quick poll, and just to take the temperature of why not do this now. And so there's 4 choices there. Not sure how to get started, budget constraints, I don't trust it's going to work yet, or just other. Okay. And I'm going to give that another few seconds here. And not surprising here, especially considering the slide that I was just talking about with all the challenges and risks, we've got about half the people saying that they just don't know how to get started. So hopefully today you're able to take something away on that, and certainly available for follow-ups to talk that through further. So these are all the challenges and risks, and you would of course assume that there's a response to those needs. And what we would look at is in terms of what's going to keep you safe in this changing environment is you want to work with proven solutions. Nobody wants to be the first experiment that ever goes out there. And fortunately, there's been lots of successful projects out there in the industry. So you want to choose a partner that has done this before. You want to keep something that's open and agnostic. So you're choosing technology that is, some of the key words would be REST architecture and just agnostic, not just open to working with 1 or 2 things. You have to own the data and know where it is and how it's being used. It has to be scalable to work today and into the future. And really, the flexibility and control, especially as we're embedding this into maybe existing applications, you have to be able to get it the way you want it and be able to configure that. And as we'll show you later in the demo, to the granular detail of what you want to be visualized on the map in certain scenarios versus others. And we believe that to be successful long term, it really has to be a platform play. We start with a point solution, one use case like wayfinding. But if you have a platform, you can build onto that and get the economies of scale. So I'm going to turn it over to Bernd, and he can tell us how some of the other things that may go on for product owners as they go on this journey.
Totally. Hey, thank you, Chris, and thanks for this great introduction. I mean, what we see every day, and if people come to us and say, and we ask them, okay, so you need wayfinding, how did you approach it, or what did you do? What they look at it, or how they look at it, is they say, okay, I just need to place some beacons. I just need to have a mobile application, and well, we will have some sort of digital maps as well. And to be frank, I wish it would be that simple, but simply it's not. So if you look at the challenge of really delivering indoor applications, what you find here on the left side this very, very confused market, this very diverse market. You've got beacons, you've got virtual beacons, you've got asset tags, you've got RFID, you've got Bluetooth 5.0, Bluetooth BLE 4.0, you've got light, you've got all those different things. And to be frank, I mean, a lot of those things make a lot of sense for a lot of use cases, but it's just a hassle to get an overview about all of this. So somebody has to take care of all of that and figure out for you what to do with it, or figure out how to do with it. And this is really the beauty of working together with us, because we, as an indoor intelligence platform, we really got to figure it out what you want to do and how you want to do it. So depending on your use cases and depending really on what you want to achieve, we will pick together with you the right technology. We will help you integrating all that services into your application development, because I mean, if you look at it, your dev team or your third-party team that creates your beautiful application, they really should focus on their core functionality. They should really focus on the UI and the UX of the whole solution. And we are really experts in terms of the indoor intelligence stuff. We will help them achieving their goals by helping them with the integration, helping them with the architecture. So in the end, your beautiful use cases like wayfinding, asset tracking, security, compliance, as well as dashboards can be achieved easily. So we're really the right partner, because we've done this multiple times. I would say at least 100 times. So we know how to integrate, and we know how to help you achieving your goals by providing you with the right framework and providing you with the right technology to use it.
Yeah, and Bernd, I would say, all of us working together, Contact.io, Indoors, and Jibestream since I think before early 2013, anyways. I mean, we've had many experiences, and as we know, it's never a completely straight line in the beginning. The things that I think early on we may have done some disservice to ourselves and to the industry in really trying to say this is super easy. We're just gonna, kind of like the first slide where you set up there, we're just gonna take these three things, and in the background we were sort of hiding the complexities and doing all the services work to make sure it works. But I think the acknowledgement now is that, these are complex systems. We're integrating into legacy systems. We're bringing, developers together and APIs together, and just by bringing that to the forefront and saying we're going to wrap it also not just with product but our people and the services to make sure they're successful has been a real game changer for us. So we would now say, hey, we make your indoor projects work versus we make them easy, because right now there's still some complexities involved, but I think that first acknowledgement is important, and we've certainly been down that road together before.
Yeah, totally, Chris. I totally agree with you. And to show how the beauty of one of those systems now looks like, maybe you can give us a short demo.
All right, here we go. Bear with me for a moment. I'm just going to switch over to my mobile app here. Okay. I'm now I'm going to start things off just by showing this is purely a developer tool. It's not designed for end users. It's really just functionality of showing how our combined technology really works together. And this is a very popular use case. I'd say right behind wayfinding, asset tracking is definitely the most popular. And it's really about saving time and maybe even lives, depending on what somebody's looking for. So the black dots here, as we can see, represent the infusion pumps. We've got heart rate monitors, wheelchairs. Really anything can be tagged, even your critical staff members that need to be called in emergencies, things like that. So people, places, or things are really the things that we're trying to visualize. And here's a great example of being able to make decisions before you get somewhere. So although I'm closest to this infusion pump, it's not a great choice because the battery's almost dead and it's not available. And so I may choose something else that's further away, but I'm going to be able to navigate to that and save time and really ultimately get to where I need to go faster. So being able to visualize information, I think this is a very important distinction as well about how we're using maps. So the maps are really broken down into objects and layers, and they can be addressed with any third-party API. So a different example might be we want to report on or visualize the temperature. And here we have an overhead map. We're using the exact same map, just connecting with a different data source. And now we can see rooms that require action. Maybe I'm a facilities manager. It could be any number of different things. So really anything that has a spatial context that needs to be visualized, we can put that in the format of a map. And the benefit here is that you're taking all that same infrastructure of the maps that you've digitized, all the integrations, you have to keep them up to date with your location, and then sending that API to maybe a different app. It could be a security guard app where we need to be aware of different things going on. It could be an urgent situation, or it could be an assault, or just general compliance. The security guard, we need to know that they've walked the perimeter of the building and gone to these doors. So through geofencing, we're able to determine that. So there's many, many different use cases, and I would have to say your imagination is the limit. Once we have fully digitized space and location connected, it's really about applying the different business rules that will satisfy the use case. So that's what we look at from the perhaps the mobile experience. I'll just sort of dive into what the administrator view would be, and this is our content management system. And you might also notice that we make a determination in the beginning of the project to satisfy the use cases. What level of fidelity do we need of the map? Meaning sometimes it's just a basic rough map because it's really just for an administrator view, or we need really high fidelity to satisfy asset tracking or beautiful aesthetic maps to present to our patients and employees and things like that. And we also make a determination, these are geospatially correct maps, meaning that they would on the world map would be corresponding with the coordinate system there, so that things like your GPS could navigate you to the parking lot, and maybe even in the future with driverless cars get you right into the parking space you need to go to. So that's all part of what we're talking about, which I think is exciting with this continuum of care and being with people. Once we have that map, we can then start to add different layers. So waypoints being all the different things on a map where you might go. It could be an amenity or a destination. It could be even a physical kiosk screen, all of your elevators. And then a very important part, of course, for navigation is your navigatable path. So once we take the blue dot from the beacons and from the indoors algorithm, basically, it's going to pass it over to us, and we're going to visualize that blue dot into one of these navigatable paths. And that's going to be all calculated in real time to take into accountability things like accessibility or things that are closed, or just considerations that you can only know that are happening basically in real time. Maybe we want to put a weighting or a ranking system on pathways to not go through quiet areas at times that are after dark or after visiting hours, things like that. So it's very configurable. We then look at things like labels and all the different things that you might want to have addressable on the map. Your people movers, and this is an important component to connecting floors, of course, and some floors are restricted, so making all those rules. And then in some complicated environments, the escalators or walkways only go one direction. So that's where we really dig into the nuances of how people are navigating, not just making the assumption that we can get somebody from A to B by drawing the shortest line. All of your amenities, and I think this is where we spent a lot of time. You know, we've been doing this for over 8 years, and the admin sort of experience is just as important as it is for the patient experience. So being able to just simply drag and drop things onto a map and add them easily. Now, the reality is that we're usually connecting through an API a lot of this data so that you don't have to make those updates, but we all know there's certain things that have to happen quickly. And so we're given the ability just to make an override in the system, as I've shown you. So that's a really high level on the content management system. We know we have a number of developers in the audience today. So the beauty of what we have here is that we are truly agnostic in terms of where this platform can be used. And there's a short slogan for it is putting maps in apps. And so you may already have your own app that you've built and you just want to add location and mapping to it. As a developer, we give you the software development kit with all the code associated with it to get started and to be able to play around and see what the functionality is. So in this case here, we can see that all of these different objects are different colors because we can address them individually. None of them are burned into the map. So if I wanted to change, a color of the floor plan, I could just go in and change some of the configurations here, and then it would automatically change. And it might be a temporary status, maybe it's a closure or a parking lot is full. All these things can be managed at the SDK level. We might also want to have different views and different layers for different use cases. So in this example here, we can see a high-level overview of the map. But as I zoom in, perhaps if I was in facilities, I would be able to see the HVAC system. And so these are the, again, differentiators of not just being able to provide for a single use case, but be able to drill down and create rules that are based on roles and access and things like that to give people more secure information if you need to. And if anyone's interested, we're happy to set up a call with our engineers to walk through our documentation, our REST API structure, and of course the SDKs themselves. Okay, so Bernd, I'm going to pass it back to you, and maybe you can tell us about what we're most commonly seeing as use cases and a little bit of story behind some of these.
Yeah, totally. Thanks, Chris, and thanks for this great demo. As we speak, we have together multiple hospital clients that, from our perspective, really start from the wayfinding perspective. So you start with a type of blue dot wayfinding application. But then if all of this is running, we typically extend those use cases, going to asset tracking, going to all those very nice use cases you just showed. But just to emphasize a little bit here on asset tracking, I really want to give you an idea why this is right now important, because for instance, the VA in Pittsburgh said publicly that they lose and get stolen about 25% of their wheelchairs, which is like $70,000 lost per year. Or the Northern Illinois hospital says that they lose about $4,000 per day looking for assets. So really just people looking for assets like wheelchairs, infusion pumps, all the assets you just showed inside of the demos. So really, when we go into a project, and this is also very important for you to understand, that only doing wayfinding, I mean, this can be done and this can be achieved in a certain amount of time, but think about it like, what will be your step 2? Think about it, what will be your step 3? Most of the time it's asset tracking. Sometimes it's then facility management, security, location-based messaging, all those use cases down the road. And you don't want to be stuck with a system that can't do that. So that's why when even implementing a wayfinding system, it makes a lot of sense to look at what your next steps, what your phase 2, phase 3 looks like, so you're not stuck somewhere down the road or stuck down the path.
Yeah, exactly. I think that's the point for sure. Is really where we're standing now is not where we're going to be, next year, as I mentioned earlier. The current landscape, I think, is it's great to talk about. Let's make this real-time health system and bring all the systems together. As we mentioned, there's complexities there. And I think the biggest blocker today, which we're able to now, I think, move past more easily, would be, my space isn't digitized. I don't have a location infrastructure. And without those two things, you really obviously can't accomplish really any of these things. So, finding that most valuable use case, which might not be wayfinding for some of you, it might be, hey, we lost $1 million, which is a shocking number, in wheelchair theft last year. Maybe that's what's going to be the thing that's going to take it forward to the first step. But as sort of looking at it as a partnership, we all kind of have to stand together and say, how are we going to, pardon the pun, navigate the future together to make sure that this is not just a nice to have, but really delivering real ROI. So I think that's a really important part of choosing a vendor is not just trying to satisfy what we're doing today, but can they help me, go into all these other things that I might want to do
down the road. Yeah.
Which really leads us to, as I mentioned to you, ROI. Again, I don't think I'm presenting any new information here about, what the benefit of an improved patient experience is. That could be anything from, increasing your HCAP scores to just frankly a better perception of the healthcare provider itself. Wait time, safety, all of these things. Compliance could be, people in areas that they shouldn't be, wearing equipment that they are supposed to have on through sensors. And this is what we know today. The sort of assumptions we can make about ROI that is visible to us. But I don't think it's an exaggeration to say, trying to predict almost what impact the internet would have. We look back 20 odd years ago and we think about, it's going to do this, this, and this for us. But I don't think any of us really anticipated how big it was going to be. And when you look at the healthcare industry in itself, there's just so much opportunity and so much leakage of efficiencies and lost opportunities that once these start to come together and we bring systems together to deliver real-time information and it's meaningful and contextual, I think the benefits are going to be definitely compounding as we move forward. So I couldn't be more excited about sort of the space right now, because as we saw in the hype cycle, it's not too early anymore, it's not too late. We're really shaping, I think, what is going to be the new norm in healthcare. Why don't we go back and now look at, now that we've seen some demos and use cases, what might resonate for you all on the phone today in terms of a use case that might get deployed? Very interesting. Normally we always see wayfinding as number one, but we are seeing actually today that more than half are asset tracking, and kind of divided up amongst the others fairly evenly. So that's certainly confirming some of the things that we're seeing and experiencing out there today. All right, so as we mentioned to you, this is a journey. It's something that we don't just start and finish on a certain day. This is really a disruptive technology that absolutely has to evolve, and part of that is even just getting it off the ground. And using the analogy of flying an airplane, the most dangerous time, as they say, is taking off and landing. And through our experiences, and we've had the benefit of all working together for a very long time, is to put together implementation methodology that really, we've had this down to a science in terms of what's going to set us up for success. How do we do this? What's the process that we need to follow? And what are the milestones as we work through where we can see that things are on track or not? And to complement that, we have what we're calling our white glove service. This is not just, a SDK that you buy and you figure out how to use and you read the documentation, call us when you have trouble. We know that doesn't work. We wrap our arms around this right from the beginning and as a unified approach, so that we're not saying, well, that's the beacon guy, that's the positioning person, or that's the app problem. Well, the real thing is everything affects everybody who's involved in the project. And so we take a very proactive approach in terms of how we manage that process, which starting with just dedicated project management. Before we even start anything, we take a sort of a whiteboarding approach to it, a discovery session, so we understand your needs. We would build out a small proof of concept or even a build for your developers to work with and see what's possible, what's not. And then we go and we apply our knowledge in terms of, okay, what level of mapping do we need today in terms of fidelity versus tomorrow? How are we going to satisfy the use cases? and cutting through the noise in terms of if you are a developer and you need access, we provide direct access to a dedicated team that has engineers on it to deliver our solutions. So, once we get over those tough hurdles, we're also looking at it all the way through. How are we setting ourselves up for the future successes in terms of architecture and integrations and things like that? Because once people start to see the value of it, we're going to have a lot of different stakeholders coming out and saying, hey, well, now that you have that, can you integrate with this or that? And that's where the conversation really gets exciting. So we've had the benefit again of being out there for quite a while, and not just what we'd like to say about ourselves, but we're getting recognition from the market, which is great. And this couldn't be more flattering or hopefully on point for us, is really what Gartner says about us being vendor agnostic to avoid vendor lock-in essentially. So as technologies change, that centerpiece to your solution of positioning and mapping will sort of insulate you from the gyrations of the world around us as it changes, because that's really the heart of everything, and we can create a stable environment for a very confused market, as we'll call it for now. We're doing much more than just wayfinding. It's more a system of intelligence. Like I said earlier, it's not just where is it, what's its status, how does it apply to the use case that we're working on. And here from a joint project that we recently finished, and that was part of an award for Kaleida Health being most wired, is that we not just focus on one use case, but they have a whole roadmap of things that they want to do now that they have this infrastructure in place. So Bernd, why don't you take us through what we do with all this information now?
Yeah, totally. So let's get started together. I mean, really, please book a discovery call or give us a short message that we set up a call, a joint web meeting together with you. We are available in both American and European time zones. And as a next step, we really do together with you an on-site whiteboarding sessions with our experts. So as we are the location experts, as we are the indoor experts, we can really come on site, help you defining your use cases and helping you defining how we best move forward. And then as a next step, let's build a proof of concept. I mean, as simple as that. Let's get this started. Let's hit the grounds running and see how indoor mapping, positioning, and all of the use cases look like in your environments, so you can really show the benefits of them.
Excellent, thanks, Bernd. I think we're going to throw up one last poll here, just in terms of time frame. And that's really, when are you planning on getting started? And yesterday is sometimes an answer, and sometimes it's a little bit more into the future. Yep, that's about what we normally see. So a few people that need to do something right away, but the bulk of the people are sort of in the next 3 to 12 months, which is I think that's a good thing, because we want to have the appropriate amount of time for planning and getting things started. Bernd, if you could wrap us up in terms of the presentation. And
yeah, so I'm the one having the nice words at the end, Leica. So really, with us as a centerpiece of your solution, you can create a really great and patient-centric environment that will meet all of your complex and challenging needs. I mean, every hospital is different, every healthcare environment is different. We've worked with a lot of those, and I think we're really here the right ones. The CEO and co-founder of Contact.io joined us today as well. I would like to shoot over some questions to him. So Simon, one of the biggest questions we face on daily basis when working with hospital is all the time, can you please explain to us, or can you please demystify the myth of battery-powered beacons?
First of all, thank you for having me, and great presentation and wonderful demo. I love it. Regarding your question, basically, we get that also quite often. People realize, okay, of course, infrastructure is important and it's expensive, and especially it's expensive to deploy. Even the cost of the hardware, sometimes it's way below the cost of the installation. We know that because we do both. So In that case, you have to go for the right hardware that will cover your infrastructure for 5 to 10 years. And of course, even though there is an infrastructure that's available, let's say the new innovative Wi-Fi access points that soon have or already have BLE on board, they only go into main places. They will not be on those narrow corridors or in remote locations of a hospital. And basically, this is where you need the navigation the most. So, for example, this is easily removed as a bottleneck to the process. Just simply looking at the infrastructure as a whole, you connect both the existing infrastructure and beacons and have unified experience across the entire facility.
Mm-hmm. Yeah, totally. Thank you. I mean, as you recently also published some blog posts, or I saw that Contact.io is really doing a lot in terms of healthcare technologies. What are your insights, or can you share some of your insights there with us?
Yeah, absolutely. We do have a lot of demand that comes out of healthcare. I think this is because the healthcare is becoming really, really aware about the benefits of the new IoT that's possible with BLE and beacons and tags. And well, long story short, of course, you already covered that. There's a tons of problems to solve, and hospitals are above the capacity or almost at its max. Assets are being misplaced or lost, and it's all about the paving the new path for that, making sure that all the use cases and the problems are solved in the best possible way, and they create a case for the ROI to be understood, and basically for the execs at the hospital being convinced that yes, the ROI is visible and it is attractive. So I think the takeaway from that blog post asking the experts is basically, 2018 will be the year of first adoptions that actually will convince the market of the ROI.
As you've worked with some providers, or with actually a lot of providers in the hospital and healthcare space, could you maybe share with us some key learnings or key takeaways as well?
Yeah, actually, I for this one, we had some experience around on deployments in hospitals, and basically, of course, there are key takeaways. Happy to share them with you. Hospitals are public places, so let's say you're deploying the infrastructure and there are people waiting. You have to be prepared that people will be actually stopping by and asking you questions, and it can be really funny, but it can be also very disturbing. And it's you have to make sure that the access that you have to the building, the access you give to people that you work with, also if you are from the hospital level, it's sufficient enough to make the installation. You don't want to end up realizing, okay, I have to deploy an infrastructure and basically I cannot access the room, and the guy who is responsible for that, he is off for his vacation. Right, and all those tiny things that would put that into details. You should have official papers, official badges, contractor badges to stay on the safe side, and basically be nice and behave properly. So nobody is paying too much attention to you, and of course, very important thing for hospitals, you have to be very careful with electronic devices. Sometimes in certain areas, designated areas, there are delicate diagnostic devices. You need to have permissions to install there anything, or come close with anything that has a strong radio signal. So there's tons of this kind of tiny things that you have to look after. Even the surfaces that you are putting the infrastructure on, it is important to know what kind of wall is that, what kind of texture it has.
What I wanted to sort of interject into all of this is it's really, as you can hear from the presentation and the questions and answers, it's technology for sure. But I think the real value here of this team working together is all of the experiences that we've had. As we mentioned earlier, nobody wants to be first, nobody wants to be the experiment. And so avoiding the pitfalls of, you know, the nuances of what happens inside a hospital or another venue is something that I think we can share through our experiences, and we're always, you know, compounding our learning from the last project, which is great. Certainly, if there's follow-up questions or to book that discovery call, we'd love to hear from you. And really thank you for taking the time to be here today.